Baclofen is widely prescribed to help ease muscle spasms and stiffness, but taking it incorrectly can cause unwanted side effects or reduce its effectiveness. Whether you're new to Baclofen or want to make sure you're using it safely, this video will guide you step by step on how to use Baclofen properly for the best results. How to use Baclofen. Baclofen is a prescription muscle relaxant used to relieve muscle spasms caused by multiple sclerosis or spinal cord injuries. It is approved for use in adults and children aged 12 years and older. How to use Baclofen properly. Baclofen is taken by mouth, usually 3 times a day. It is available in several forms to suit different patient needs, including tablets, oral solutions, such as Ozobax DS and Flexivy, and dissolvable granules, Livispa, which can be helpful for individuals who have difficulty swallowing pills. Always follow your healthcare provider's instructions on how to take this medication, and do not stop taking it suddenly without medical advice, as it may lead to withdrawal symptoms. What Baclofen is used for. This medication is specifically prescribed to reduce muscle stiffness and spasms associated with multiple sclerosis or spinal cord injuries in patients 12 years and older. Possible side effects of Baclofen. Some side effects may lessen over time as your body adjusts to the medication. It's important to monitor any changes and speak with your healthcare provider if symptoms persist or become severe. Common side effects: sleepiness up to 63%, dizziness up to 15%, weakness up to 15%, nausea up to 12%, confusion up to 11%. Other potential side effects include headache, feeling tired or low energy, constipation, frequent urination, trouble sleeping, metallic taste in the mouth. How to use Baclofen. Baclofen is used to manage muscle spasticity related to conditions like multiple sclerosis, spinal cord injuries, and cerebral origin spasticity. It can be administered orally or intrathecally, directly into the spinal fluid, depending on the severity of the condition and individual response to treatment. Understanding how to use Baclofen correctly is essential to achieving optimal relief and minimizing side effects. How to use Baclofen orally. Initial adult dosage for spasticity. Start with 5 mg taken orally 3 times daily for 3 days. Increase to 10 mg 3 times daily for the next 3 days. Then 15 mg 3 times daily for 3 days. Followed by 20 mg 3 times daily for 3 days. Maintenance dose. The effective maintenance dose should be individualized based on patient response. Maximum dose: 80 mg per day, 20 mg 4 times daily. Use the lowest effective dose to minimize side effects. If there is no benefit after a reasonable period, the medication should be tapered off gradually. Oral Baclofen is used for spasticity due to multiple sclerosis, relief of muscle spasms, pain, clonus, rigidity, spinal cord injuries, and related spinal conditions. How to use Baclofen intrathecally, spinal administration. Intrathecal Baclofen is considered for patients who do not respond adequately to oral treatment or experience intolerable side effects. It involves a screening phase followed by implantation of a pump for continuous infusion. Screening phase: adult patients. Initial screening dose: 50 micrograms injected into the spinal fluid. Observe for 4 to 8 hours. If no response, second dose: 75 micrograms after 24 hours. Third dose: 100 micrograms after another 24 hours. Patients must show a positive response, reduced muscle tone or fewer spasms, to continue with long-term therapy. Post-implant dose titration. After successful screening and pump implantation, begin with the screening dose, or double, depending on response, over 24 hours. Do not increase dose in the first 24 hours. Afterward, spinal cord spasticity. Increase dose by 10% to 30% every 24 hours. Cerebral spasticity. Increase dose by 5% to 15% every 24 hours. Maintenance dosing intrathecal. For spinal cord origin spasticity, daily doses typically range from 300 to 800 micrograms per day. Some cases require up to 2003 micrograms per day, though over 1000 micrograms per day is less common. Dose may be adjusted during refills by 10% to 40%. For cerebral spasticity, maintenance range, 90 to 703 micrograms per day. Adjustments during pump refills may be 5% to 20%. Note: if side effects occur, doses may be reduced by 10% to 20%. Chronic use and adjustments. Around 5% of patients may become tolerant to their current dose. A drug holiday may be necessary, involving gradual dose reduction and temporary alternative therapies. Restart therapy at the original effective dose after the break. Dosing must be adjusted cautiously in patients who rely on some spasticity for mobility or posture. Important considerations when using Baclofen. Only continue intrathecal therapy after a confirmed positive screening trial. Long-term use may require ongoing dose adjustments. Avoid abrupt discontinuation, as it may lead to severe withdrawal symptoms. Patients with traumatic brain injury should delay intrathecal therapy for at least 1 year post-injury. Treatment should be administered and monitored in a facility equipped for emergencies. Use: Baclofen is prescribed for severe spasticity of spinal or cerebral origin when symptoms interfere with daily functioning and other treatments are inadequate. Always follow medical guidance to ensure safe and effective use. How to use Baclofen safely starts with following your healthcare provider's exact instructions. Never change your dose or stop taking Baclofen suddenly without consulting your provider. Abruptly stopping the medication can lead to withdrawal symptoms such as nausea, fever, and muscle spasms. If discontinuation is necessary, your provider will guide you on gradually tapering the dose to prevent complications. Baclofen may be taken with or without food. However, some individuals experience nausea, so taking it with meals can reduce this effect. It's important to be consistent in how you take it based on your tolerance. Inform your healthcare provider if you've had a stroke. Baclofen may be less effective in such cases, and alternative treatments might be more appropriate for managing muscle spasms. Drowsiness and dizziness are common side effects. Do not drive, operate heavy machinery, or perform tasks requiring alertness until you understand how the medication affects you. Avoid alcohol while using Baclofen. Alcohol can intensify drowsiness and other side effects. If avoiding alcohol is challenging, discuss alternative medications or support options with your provider. Tips for Baclofen tablets. If splitting tablets is necessary, always use a pill splitter for accuracy. Baclofen tablets have a score line to help divide the dose evenly. Tips for Baclofen oral solution. Baclofen oral solutions are available in different strengths. Carefully check the label to ensure you're measuring the correct dose. Always use the dosing tool provided by the pharmacy. Avoid using household spoons, which can lead to incorrect dosing. Tips for Livispa oral granules. The granules can be taken directly by emptying them into your mouth, where they dissolve quickly. Alternatively, mix the contents with up to 15 milliliters of soft food or liquid such as applesauce, yogurt, or pudding. Take the full dose within 2 hours of mixing. Using Baclofen the right way can make all the difference in managing your symptoms safely and effectively. Always stick to your doctor's instructions. Never change your dose without consulting your healthcare provider. And watch for any side effects. If this video helped you, don't forget to like, share, and subscribe for more trusted health tips. Take care and stay well.